Hey, well, Dr. Morales, following up on my frequently asked questions of the week. Get these from my patients, and the question is today is associated to a mind makeover, and the question is what makes a good candidate for a mind makeover? So I guess the first thing we need to address is what is a mind makeover. The mind makeover is this catch-all term that we address for us one surgery that addresses both the changes associated with pregnancies for women in the breast and the body, specifically the abdomen. So if you can do like a breast lift with a tummy tuck, or breast augmentation with a tummy tuck, or some contouring somehow of the abdomen with the tummy tuck, or maybe some liposuction, and then something with the breast, fat transfer. I don't know. But in any event, you're addressing the postpartum changes associated to a pregnancy, which is deflation of the breast, or maybe some sagging of the breast, rejuvenating abdomen because the skin has been a little bit looser, a little more fat on it. That's what really the components of a mind makeover is. And so women who are candidates for a mind makeover are going to be those women who've had maybe one, maybe two pregnancies and have had these changes. So it could happen one time. You get pregnant once, you have this big baby, you gain a lot of weight, breastfed, just your breast is completely deflated of all the breast tissue, and you lost all the weight, and then now you have these a little bit saggier breasts that are completely deflated. Your abdomen has tons of stretch marks on it, carrying a big baby, and you have more abdominal fullness than you used to before you had children, and you got an extra skin with some fold, and it just loose. Maybe holding a little more extra weight in the midsection. That's a very common, I would say, patient who comes to me for a mind makeover. And so, can these surgeries be done separately? Absolutely, absolutely can. I would say most women now who come visit me are going to do it together, though, and the reason for that is really threefold. The first reason is that it's actually financially cheaper because you're only opening the operating room one time with one team of staff, one anesthesiologist, myself, obviously, and all these multiple procedures can be combined, and we use the same equipment, and there is no downtime putting a patient to sleep, getting their room ready, and then taking it down again. So it's only one event. Biggest reason is that it's one recovery. Typically all the recoveries from these procedures is included in the one. So it's a little more convenient to do it at one time. So that's a typical example of a mind makeover. Usually it's a surgery that's planned way ahead of time. These women that are looking at, they've been thinking about this for a long time, and you really need to accommodate a recovery for this procedure, which is usually 2 to 3 weeks for most women. So summertime is very busy for us. The Christmas time season when kids are out of school, maybe the spring break season, the Thanksgiving break, like these times when most people have time off from the school season, they come visit people like me. So happy to help. Thanks for the questions. Keep bringing them. Talk to you next week.